Hello, you're listening to Health Professional Radio. I'm your host, Neal Howard, and very, very glad that you could join us here today. Our guest in studio today for this Health Supplier segment is Dr. Kyra Bobinet. She's a national speaker, author, and CEO and founder of engagedIN. engagedIN is a neuroscience behavior design firm. Kyra devotes her life to cracking the code of why we engage in our health, and her work has earned her several accolades. She received the 2015 Innovator Award from Harvard, where she received her master's in public health. She earned her medical degree at University of California, San Francisco School of Medicine. And she's here today to talk with us about her firm, engagedIN. Welcome, Dr. Bobinet.
Thank you, Neal, for having me.
Thank you so much. engagedIN, talk a bit about behavior design and how engagedIN is moving toward having the concepts of behavior design permeate the medical community.
Absolutely. So engagedIN was rolled out of Stanford, and I had studied in the behavior design lab there with Dr. B.J. Fogg, who I would say coined the term. And really, it's about taking the latest in neuroscience and behavior science and translating those insights, which are normally sort of ahas on a medical level or scientific level, and making those applicable to products, interventions, things that change lives. So, for example, there's mobile apps, but somebody may build a mobile app without the behavior design component, and then people just don't use it, or they abandon it quickly. So what we do is we enhance the experience and the longevity and the usability of health technologies, of health communications, of health interventions, to help people do what is best for them and what they intend to do, by working for things in respect to their brain, how their brain sees the world, how their brain wants to respond, what it tends to do at scale. And we do this for whole populations of people, whether it's teenagers or people who are HIV positive or people who are after a heart attack who want to change their behavior, or people who are taking care of elder parents. It's very applicable across all human conditions.
Now, you are a physician as well as a behavior designer and an author, the author of your book that's available on Amazon, A Well-Designed Life, 10 Lessons in Brain Science and Design Thinking for Mindful, Healthy, and Purposeful Life. Being a physician, on a scale of 1 to 10, 10 being completely immersed in healthcare research where new innovations are involved, and 1 being maybe a little bit of healthcare, but let's look at all these other life aspects first. Where would you think that engagedIN would fall?
Yeah, I would say that engagedIN is the translator, maybe a 10 at the crest of where all that scientific discovery becomes applicable, usable, and translatable into actual, efforts, of bringing it to the people, so to speak. A lot of it is published and then forgotten about, frankly, or, it's kind of one of those things as a human species, if we only knew what we knew, because the nature of research is that people get really, really specific and tunneled into one particular level of insights, and then they publish on that, and then it's kind of a tree that falls in the forest that no one hears. And engagedIN is listening to all of that and collating it, and then making that available to actionable physicians, hospitals, tech companies, that kind of thing.
Now, I understand that you're focused on all areas of life. With technology being able, we can be anywhere basically we want to within a matter of a keystroke. What are your geographical limits as far as engagedIN is concerned? And do you have representatives that go far from your base in order to educate clients or to talk to prospective clients?
Right. So we do have a couple of global clients. We've had a client in China, South Africa, considering doing a project in India now, and that kind of thing. I find it very applicable because, the human brain is architected the same no matter what the culture is. And then there's cultural nuance, which, from our point of view, has to do with how people see themselves. And as long as you can design for that and they still recognize themselves, they still feel seen and heard, then you can use basically the rest of the behavioral science to reach them and help guide their behavior to the benefit of what they want to do.
Now, when you're out speaking about engagedIN and design thinking, what is the biggest misconception about engagedIN and your work in design thinking that you'd like to clear up while you're with us here today?
Oh, that's a really good question. I think the thing I see the most is, oh, you do behavior economics, which behavior economics is, I would say, one tiny tool, but it's almost like, you can't build a home with just a hammer. Behavior economics is a hammer, but there's a whole lot of other tools like behavior economics that have to do with how the brain operates, that we have a full complement of those.
And are you engaged in any educational efforts within universities or schools? Do you go and talk about engagedIN and any opportunities that medical students, psychology students, or even engineers may have an interest in and can get in touch with you?
Yes, I'm co-teaching a class at Stanford School of Medicine with Dr. Larry Chu this coming winter quarter, 2016. And we had done this class. It's called Engage and Empower Me. They had offered it as a MOOC, so international. We had about 3,000 international students and U.S. students that took that course last time. This time we're going to be doing a simulation of different environments that would reflect how the brain moves through an environment. For example, if you have a home, it's well known that putting cereal boxes on the counter typically causes people to be about 20 pounds heavier than if you don't have cereal boxes on the counter. Those kinds of manipulations we want to look at with the students. What triggers behaviors of what kind? What drives somebody towards healthful versus not healthful behaviors using the environment?
Where exactly are you located as far as engagedIN? How can our listeners get in touch with you? A website? And also, when it comes to your interaction with students, how much of these students are actually psychology students who are looking to bring new ideas, maybe to some old hardline psychologists?
Right. I mean, there's definitely a movement across a lot of student bodies and a lot of different majors that are starting to look at human behavior as important to them. Marketing was one of the first, advertising marketing. Certainly behavioral neuroscience majors are cropping up, health promotion, public health, any pre-med, any medical school. We have engineers, technologists, MBA students in our courses. So it really appeals broadly across all the different students. And, people can go to designyourbehavior.com for more information if they wanted to get a hold of me to discuss their interests. I'm very interested in this ideology spreading and assisting people to be more effective in their respective discipline.
You've been listening to Health Professional Radio, our Health Suppliers segment, and in studio today with us is Dr. Kyra Bobinet. She's a national speaker, author, and CEO and founder of engagedIN, a neuroscience behavior design firm where her work has earned her the 2015 Innovator Award for Harvard, where she received her master's in public health. She also earned her medical degree at the University of California, San Francisco School of Medicine, and she's the author of Well-Designed Life, 10 Lessons in Brain Science and Design Thinking for a Mindful, Healthy, and Purposeful Life, available on Amazon. And we've been here talking today about engagedIN and how anyone involved or interested in bettering their way of thinking can be greatly benefited by getting in touch with those at engagedIN. It's been great talking with you today, Dr. Bobinet.
You too, Neal. Thank you for having me.
Thank you so much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.